Thank you for choosing Union Oral Surgery. Here are a few things to help you after your surgery with an immediate denture. After your surgery, you may have some gauze in your mouth to help slow down the bleeding. You may have to change that gauze every 20 to 30 minutes until you get the bleeding to stop. It's perfectly normal to bleed, and it may sometimes ooze over your denture. In that case, you just take your denture out, rinse your denture, stick it right back in your mouth because it's acting as a Band-Aid. Remember not to leave the denture out for more than about 10 to 15 minutes because if you do, it may swell in there and you might not be able to get that denture back in until the swelling resolves in a couple days. After your surgery, you may experience bleeding throughout the day. You do want to notice it gradually getting lighter after the first several hours. If into the afternoon and evening you're noticing that the bleeding is not slowing down or it's getting worse, please give us a call as we can help you figure out how to slow that down, or we may need to bring it into the office to help you get it slowed down. Remember, for the first 24 hours, you don't want to rinse your mouth out. After 24 hours, you can start rinsing with some warm water or warm salt water to help soothe and start healing those areas. For the first week or so, you do want to wear your denture all the time unless you're taking it out to rinse it. You want to sleep in that denture and don't leave it out for more than 10 to 15 minutes. Having a denture is definitely a big adjustment for everybody. It's something that will help you get through the process with, will help you get the best fit, but it is going to be a challenge. Eating and drinking is going to be a little difficult for the first couple days. You're just going to have to find what works best for you. We always advise soft things, stuff that's easy to chew, casseroles. We want you to stay really hydrated, but remember, no straw for the first 24 hours. We want you to avoid rinsing, spitting, swishing, and using a straw for 24 hours. When that 24-hour mark is up and you start rinsing your mouth, you can also start brushing your remaining teeth like normal to keep the hygiene as good as possible. You may be given a prescription for an antiseptic mouth rinse to use twice a day. If not, you can do warm saltwater rinses up to twice a day as well. Take all medication as it is prescribed to you. You may be given an antibiotic and a couple different types of pain medicine. If you're needing to take the stronger pain medication, just remember not to operate a motor vehicle for at least 24 hours after taking it. You can resume normal activities usually in about 2 to 3 days. Some people may need a little extra time to heal, which is normal. This is a big adjustment, so just take the time and let your body recover. Swelling is very common after your procedure. You want to go home, keep your head elevated, use the ice as directed, 20 minutes on, 20 minutes off, as much as you can the first 24 hours. After 24 hours, if advised, you can start to use some heat to get that swelling down. And don't forget that the swelling is going to happen inside of your mouth too, so you want to keep that denture in as much as possible for the first week and even sleep in it. Don't be surprised if your swelling worsens on the second and third day. That is normal, and it will start to gradually decrease over the 4th to 7th day. If you're finding it difficult to open your mouth all the way, or you're experiencing tightness of the cheeks, that can be due to the swelling. Just continue the heat or the ice as directed, and that will resolve itself in a week or so. After the swelling goes down, your denture may fit a little loosely, and you're going to be tempted to use some denture adhesive cream. Do not use denture adhesive cream until you get the go-ahead from your doctor that it's okay to use those so that you don't upset those surgical sites. Following your procedure, there are a few normal things that may or may not occur. Bruising is definitely one of them, but different for everybody. Some people will not bruise at all. Some people will have significant bruising that can even go down the neck. It's normal, don't worry about it. Apply some heat to help break that up. Some people get bony fragments after the surgery. Those usually work their way out on their own, but you may need to return to the office to get some assistance in getting those out. The sutures that we use typically dissolve on their own. If we use anything other than the dissolving sutures that need to be taken out, we will let you know at your surgery appointment, and we will usually take those out at your first post-op. Smoking is the #1 cause for problems after surgery. It can lead to prolonged healing, pain, and infection. Patients should not smoke for a minimum of 5 days after the surgery and longer if you can help it. We understand that getting used to a denture is a big thing, and we're here to help you get it as comfortable as possible. Just remember, after your surgery, you're free to call us with any questions or concerns that you may have. Even after hours, we have a number that can get you in contact with one of the doctors if